If you want to get better with less medicine, the answer is simple. Improve your lifestyle. On this channel, we bring you the advice of Dr. Anirban Chakraborty, explained in a way that is simple and practical, so that you do not need to keep increasing your medicines to stay well. Follow us here for more videos on the 4 pillars of Dr. Chakraborty's method for controlling diabetes and metabolic illness: diet, exercise, sleep, and stress. Now let me ask you a question. Have you ever wondered why diabetes and obesity often come together? Why so many people who gain weight also develop high blood sugar? The answer lies in a hidden condition called insulin resistance. Today, I will explain what insulin resistance really means, how it develops inside your body, why it can silently harm you for years before you are even diagnosed, and most importantly, how you can fight back with simple lifestyle changes. So let's begin. When we eat food, our body digests it and turns carbohydrates into glucose. Glucose is a simple form of sugar. It is the main fuel that gives us energy. Once glucose enters our blood sugar level rises. At this point, the pancreas comes into action. The pancreas is a small but very important organ in the upper part of your abdomen. It lies just behind your stomach and next to your liver. Most people do not think about it, but without the pancreas, life would be impossible. This organ produces digestive juices that help break down food. And it also produces hormones, including insulin. Insulin is like a key. It opens the doors of our body's cells so that glucose can move inside and be used as fuel. Think of your muscles, your liver, even your brain. All of them need glucose to function properly. And insulin is the hormone that allows glucose to enter these cells. When everything works smoothly, this process is beautiful. You eat. Your blood sugar rises. The pancreas releases insulin. Insulin opens the doors. Glucose enters the cells. Energy is produced. And your blood sugar level goes back down to normal. But here comes the problem. When we keep eating highly processed foods, white bread, fried snacks, sugary drinks, sweets, and refined rice, the blood sugar rises very often and very quickly. The pancreas responds again and again by releasing large amounts of insulin. Over the years, the cells become tired of listening to this signal. They stop responding well to insulin. This is called insulin resistance. You can imagine insulin resistance like a lock on a door becoming rusty. Earlier, one key was enough to open the door. Now you need 5 or 10 keys, and even then the door barely opens. In the same way, your body needs more and more insulin just to push glucose into the cells. At first, the pancreas works harder and produces extra insulin. So blood sugar may still appear normal for some years. But inside, trouble is brewing. High insulin levels force the body to store fat, especially around the belly. This is why insulin resistance often leads to central obesity. At the same time, glucose struggles to enter the cells, so blood sugar gradually rises. This is when prediabetes or type 2 diabetes finally appears. And here is something important to understand. Insulin resistance can silently damage your body long before diabetes is diagnosed. It can increase your risk of fatty liver, heart disease, high blood pressure, and even certain cancers. All this can happen without you realizing it. So what are the early signs? If you are gaining weight around the waist, if you feel unusually sleepy after meals, if you find yourself craving sweets and snacks frequently, or if you feel tired most of the time, these can all be early warning signs of insulin resistance. Now let us talk about the good news. Insulin resistance is not a life sentence. It can be reversed. And when you reverse it, you lower your blood sugar, reduce your weight, and increase your energy levels. The key lies in lifestyle. Dr. Anirban Chakraborty teaches a 4-pillar method. The first pillar is diet. The food we eat every day is the biggest driver of insulin resistance. Refined carbohydrates, sugar, and processed snacks push the pancreas into overdrive. The first step to recovery is to reduce these foods. Replace them with vegetables, lentils, pulses, fish, eggs, nuts, seeds, and unprocessed grains. When you eat real food instead of packaged food, your insulin levels calm down. The second pillar is exercise. Think of your muscles as powerful sponges. When you use them, they soak up glucose from the blood. This makes them highly sensitive to insulin. The opposite is also true. When you sit all day without movement, your muscles stop responding to insulin. This is why regular activity is so important. You do not need to spend hours in a gym. Even a 20-minute brisk walk, a few body weight exercises at home, or yoga can make your muscles more insulin sensitive. The third pillar is sleep. Most people underestimate how vital sleep is for health. When you sleep less than 6 hours a night, your body produces more stress hormones. Your appetite increases, your cravings for junk food go up, and your cells become more resistant to insulin. On the other hand, 7 to 8 hours of quality sleep each night can improve insulin sensitivity. So good sleep is not a luxury. It is medicine. The fourth pillar is stress management. When you are constantly stressed, your body produces cortisol. This hormone makes your blood sugar rise and worsens insulin resistance. This is why modern life, with its deadlines, screens, and constant pressure, can be so damaging. Simple practices like meditation, breathing exercises, prayer, or spending time in nature can lower stress. And in turn, they make insulin work better. Let me give you a real-world example. Imagine two people with the same blood sugar. The first person only takes medicine but keeps eating unhealthy food, sleeps late, and hardly moves. The second person also takes medicine but changes lifestyle. They eat clean, walk every day, sleep on time, and manage stress. Which person do you think will need fewer medicines after a year? Which person will feel lighter, more energetic, and healthier? The answer is obvious. It is the second person. Because lifestyle is the real medicine that targets the root cause. So remember this. Medicines can control blood sugar, but only lifestyle can correct insulin resistance. If you focus only on medicines, your prescription will usually increase year after year. But if you address insulin resistance, you can reduce your medicines and sometimes even stop them. This is the approach of Dr. Anirban Chakraborty. Not just covering up the problem with tablets, but guiding you to fix the root cause with small, practical changes. If you found this video useful, do not keep it to yourself. Share it with your friends or family members who are struggling with diabetes, obesity, or metabolic illness. Because awareness is the first step to change. Now, if you want personal help, you can book an online appointment with Dr. Anirban Chakraborty from anywhere in the world. The number to call or WhatsApp is 8910902547. You can choose a regular consultation, where he prescribes medicine if required. Or you can join a special reversal session, where he studies your lifestyle in detail and gives you clear, simple steps to reduce illness with less or no medicine. Once again, the number is the same. Take this step for yourself. Your health is your greatest asset. With the right knowledge and the right guidance, you can take back control. Thank you for watching. And stay connected for more videos on the 4 pillars of diabetes and metabolic illness control. Diet, exercise, sleep, and stress.